Hello and welcome to the 2021 World Cancer Leaders Summit. I'm Hanna Vaughan and it's my great pleasure to be your host for this exceptional 2021 edition, which will take place virtually for the first time. Our studio today is based in Geneva, but as you know, we were all supposed to be in Boston for the summit. Now, the summit hosts, the American Society for Clinical Pathology, are now in Boston running their annual meeting. However, we will try and connect with them over the two-day summit at various times. Now, the theme that we're addressing this year is driving innovation to advance cancer control equitably. Over 2 days, we're going to be hearing from more than 60 speakers who will share their perspective on this topic. And so far, up to 600 invited leaders have connected to this event, representing up to 100 countries. Now, all sessions broadcast both today and tomorrow will be available for up to 3 months on demand on the Summit platform. That's in the digital library. The platform itself will enable you to follow the event live, ask questions to the speakers, chat to the other invited leaders, and of course connect with them one-on-one and view each other's profiles, as well as all the profiles of partners and sponsors involved. Please, if you do experience any technical challenges, contact the help desk. And we also encourage you to join the online conversation for the summit on social media using at UICC and also at ASCP_Chicago on Twitter, and by using the official hashtag 2021 WCLS. We're also going to be welcoming throughout the 2 days an interactive performance from Bubba Brinkman. He's a rapper who's going to be joining us live from the United States, and I'm told this is a performance you will not want to miss. Kicks off today at 12 o'clock, that's Boston time, 6 p.m, where I am here in Geneva. Now, to get us started today and to open this first virtual World Cancer Leaders Summit, let's hear from the UICC President, Dr. Anil de Cruz. Dr. de Cruz.
Excellencies, distinguished guests, friends and colleagues from around the world, ladies and gentlemen. Welcome to the World Cancer Leaders Summit, which for the first time we are delivering virtually. And what can be more apt in surreal times like these than the theme, driving innovation to advance cancer control equitably. Despite the shift to a virtual format, enthusiasm has not waned. And over the next 2 days, more than 500 global health leaders will tune in to discuss innovation and how it can help us address the inequalities apparent in cancer control across the globe. Nearly 100 speakers and panelists have already, as part of the program released on the official platform On the Road to the Summit, or will provide their insights, experiences, and thoughts to what we can and what we must do to address this growing global cancer burden. Importantly, as this burden is likely to be more prevalent and more devastating in countries which are already struggling to support the patients they have today. Let me start by acknowledging some people and organizations who have worked tirelessly and diligently in the last 2 years to bring this summit to you. Originally, we had planned to be in the beautiful city of Boston, one of my favorite cities too, enjoying each other's company with our dear friends, the American Society of Clinical Pathology, the official hosts for this summit. Sadly, despite being patient and waiting for as long as we could, the pandemic's restrictions on international travel made that dream impossible, and we were forced to take the decision to be here virtually instead. Throughout the planning and the difficult decision of converting to the virtual format, Blair Holliday, Dan Milner, and Suzanne Zemnick have been incredibly supportive, outstandingly professional, and an absolute pleasure to work with in designing what you will experience over the next 2 days and what many of you have already enjoyed on the Summit platform in the past few weeks. Blair, Dan, Suzanne, and the rest of the ASCP team, a big thank you to each one of you. We are also indebted to our colleagues at the World Health Organization, the International Agency for Research on Cancer, and the International Atomic Energy Agency for the ongoing partnership in designing and supporting the now biennial World Cancer Leaders Summit. We genuinely appreciate the advice, guidance, and support they provide in shaping the program, recommending speakers, and providing the UICC team with their knowledge and enthusiasm. My personal thanks to Andre Ilbawi, May Abdul Wahab, Freddie Bray, Clement Chauvet, and Philip Mehus. Events like the World Cancer Leaders Summit and the World Cancer Congress need financial support and the engagement of partners to help them take shape and bring them to life. The sponsors of this year's summit have shown tremendous resilience in a difficult year, and despite sharing our sadness that we do not have our hybrid meeting, they have continued to support the summit wholeheartedly, and for that I'm truly grateful. Without their support, we would not be able to bring together the world's leaders in cancer control to discuss critical strategic issues every other year. COVID-19 may still be dominating the agenda of most country leaders, but let us not forget that cancer continues to be a critical health issue which demands a global voice, and it is here at the summit where that global voice can be heard the loudest. So my thanks go to all of them, and especially our gold and platinum sponsors, the US National Cancer Institute, Pfizer, and Sanofi. Over the next 2 days, we will have the pleasure of seeing, listening, interacting with many of the world's who's who in global health. We have prepared a program which features recorded segments, live presentations, interactive live panels, and on a platform which enables us to chat, pose questions, and reach out to each other. In parallel to the central program, there are side sessions which you can easily toggle between as we progress through the next 2 days. Mindful that the time zones are not compatible in every part of the world, the central program is being recorded and will be available over the next few weeks and months to play back. You can watch again or catch up with sessions you have missed the first time round. Unprecedented times stir the innovators in all of us. We have witnessed dramatic impacts on cancer screening, increased reticence from patients to present early, and delayed treatment and care around the world. Cancer treatment has been made complicated for those with COVID-19, and cancer centers, societies, patient groups, and others have had to be creative to continue supporting patients and keeping their own organizations effective during a financial crisis off the back of a global health crisis. We will, of course, touch on the pandemic in the next couple of days, but we shall also focus on what we've learned as a cancer community and how we can build on that learning in the years to come. I will not preempt some of the content by giving you my own views at this stage. However, I would encourage you to join me tomorrow, Tuesday 26th at 1:05 p.m. Eastern Time for the announcement of the winners of the Outstanding Contribution to Cancer Control Awards. It will be a pleasure to recognize 6 outstanding individuals and announce the names of 2 winners for 2021. We have an amazing group of presentation and panels to enjoy and learn from. Please interact with your fellow attendees and post questions on the platform to encourage discussion and debate. Please follow the discussions on social media and join the online conversations by following @UICC and @ASCP_Chicago on Twitter and by using the official hashtag #2021WCLS. I thank you for joining the World Cancer Leaders Summit live today. Let's start the day addressing the title of the summit, Driving Innovation to Advance Cancer Control Equitably. I will now hand over to our MC, Hanna Vaughan Jones, who will be guiding us through the summit from the studio in Geneva. I wish you all an enjoyable and interactive 2 days. Welcome to the summit again. Thank you.
Dr. Anil de Cruz, many thanks indeed to you. And we look forward, of course, to hearing more from Dr. de Cruz tomorrow as that award ceremony takes place around 1 o'clock Eastern Time, as he just said. Now, the World Cancer Leaders Summit is held in partnership with 3 UN agencies. There's the World Health Organization, the International Atomic Energy Agency, and the International Agency for Research on Cancer. So let's now hear from the WHO Director General, that's Dr. Tedros Adhanom Ghebreyesus. Dr. Tedros.
Dear friends and colleagues, 2 weeks ago, I bestowed the WHO Director General's Award posthumously on Henrietta Lacks. The cells taken from Henrietta without her knowledge or consent have become the basis of innovations that have saved the lives of many people. And yet, many of those innovations remain out of reach for people who are poor, vulnerable, or marginalized. For most of the 20 million people diagnosed with cancer each year, services are not accessible. We cannot tolerate this. That's why WHO continues to call on all countries to make the political and financial commitment to universal health coverage and strong primary health care. And it's why innovation is so important. We need new tools, but we also need new ways of expanding access to those tools. Inequitable access to COVID-19 vaccines shows that innovation can widen inequalities unless we take steps to ensure all people have access to the fruits of innovation. It's also essential that innovation in cancer is driven by the needs of the most vulnerable countries and communities, not the needs of the most powerful companies and their shareholders. WHO remains committed to working with all partners to foster innovation for a healthier, safer, fairer future for all people. I thank you.
And we thank you, Dr. Tedros. Now, we're going to stay with the World Health Organization now and hear from Dr. Benty Mikkelsen, who is Director of Non-Communicable Diseases in the division of UHC, Communicable and Non-Communicable Diseases.
Thank you, Dr. Tedros, dear colleagues and friends. I would like to begin with a word of congratulations. Congratulations to UICC for 15 years of successful Leader Summit. And congratulations to all organizers for bringing us together in spite of the uncertainty and obstacles born from the COVID-19 pandemic. We are facing the greatest cascade of crises in our lifetime. COVID-19 has shocked our health system. Services are disrupted. Science is under assault. Misinformation is polarizing people and paralyzing societies. Solidarity is missing in action. Our ways of work must be changed. They must be recalibrated towards greater progress and equity. There are guiding principles of success and of universal health coverage. The 2020 WHO report on cancer established that increasing access to an essential set of cancer services as part of UHC can save 7 million lives over the next decade. Let me say that again, 7 million lives. This would bend the curve of premature mortality toward achieving the SDG target before 2030. So, are we on track? No, and the pandemic has set us back further. But there are reasons to be hopeful, to commit more, and to act on new opportunities. At WHO, we have 3 integrated global cancer initiatives: Cervical Cancer Elimination Initiative, the Global Initiative for Childhood Cancer, and the Global Breast Cancer Initiative. These initiatives are now active in more than 50 countries, and progress has been achieved because of more than 200 strategic partners are supporting implementation. Many of our partners are here today, and I would like to pause and express gratitude for our collaborative work that has focused on impact. Thank you to our partners from civil society, cancer centers, WHO collaborating centers, professional groups, development partners, and private sector. We are slowly changing the tide. Yet, while there have been progressive improvements in global cancer control, the pace of change has been more sluggish and too unbalanced. Many are being left behind, particularly as new technologies are only available to select privileged communities. Innovation is the means by which we should promote equity, not worsen it. I would like to highlight areas of innovation that have accelerated progress and that have leveraged the 3 WHO cancer initiatives. First, on HPV vaccination. In 2018, the WHO Director General, Dr. Tedros, had made the call for action towards the elimination of cervical cancer. Thank you, Dr. Tedros. This has been followed by a global strategy adopted by all governments around the world. One of the 3 targets by 2030 is 90% coverage with HPV vaccination. WHO, working with partners, have been able to shape the HPV vaccine market and pre-qualify vaccines. Supply is expanding, prices are improving to promote access. This is equitable innovation. Second, a focus on innovative health products and financing for childhood cancer. WHO, working with global strategic partners, including St. Jude's Children's Research Hospital, has shaped a global agenda focused on meeting the needs of children with cancer and the countries in which they live. Innovation has been an emerging fixture for the initiative. This includes the development of new medicine formulations for children, innovative financing instruments like social impact bonds, and also innovative approaches to care focused on quality improvement programs and mediated by WHO communities of practice. The success of these innovation work streams is because they are driven by local needs. With routine dialogue among the 40 countries participating in this initiative, and by using a child-centered approach, we have better understanding linking innovation to needs. Finally, the WHO Global Breast Cancer Initiative is driving innovation in service delivery by focusing on how to navigate women with breast cancer through the pathway of care. Women who are poor, who are single or widowed, women who live in rural areas are at risk of being left behind, literally and figuratively. Advanced stages of diagnosis is common because of delays in care. Investment have been made biased towards cancer centers and not towards primary health care, which is the driver of universal health coverage. The WHO Global Breast Cancer Initiative is inspiring innovative approaches to empower women throughout their life course. These 3 examples show how innovation, when focused on needs and equity, are driving us towards a brighter future. I would like to close with an invitation to join together to delivering on the promises of innovation. Together, we need to add potential and use the opportunity to engage and co-create solutions with those living with and affected by cancer. This is not the first time innovation has been highlighted in the World Cancer Leaders Summit and will for sure not be the last. But this summit is different. We are living through the worst pandemic of the last century, concurrent to the epidemic of the non-communicable diseases. Over the next decade, another 200 million people between the ages of 30 and 70 years of age will die from NCD unless we do things differently. We all feel the acuity. If there has ever been a moment for global solidarity and investment in innovation, the time is now. Innovation must drive equity. Equity is at the heart of all we do in all areas of health, including in the field of cancer that we are discussing today. The global health architecture in cancer control is at the moment at its strongest point yet, but we must leverage this. At WHO, we have crafted cancer initiatives as a global community to meet country needs and to drive progress. We stand ready and eager to work with partners across sectors to innovate, to implement, and to create a better tomorrow for all, a better health for all. Millions of lives depend on us. With this, I wish you a very successful summit. Thank you for having me.
Dr. Mikkelsen, thank you very much for being with us and for that particular opening speech as well. We now have the pleasure to go to Vienna and hear from Rafael Mariano Grossi, who's the Director General of the International Atomic Energy Agency. Director Grossi.
Welcome to the World Cancer Leaders Summit. It is a pleasure to welcome you to this wonderful event. As you can see, I'm not sitting in my office in Vienna, rather in the outskirts of the city at the wonderful laboratories in Lower Austria in Seibersdorf, where most of our technical scientific work takes place. This year, as every year, we are happy to be working again with you, and in particular with our host, the American Society of Clinical Pathology, and our partners, including the World Health Organization, WHO, and the International Agency on Cancer Research, as well as the community of UICC. So all of you there working with us here from the IAEA to make sure that cancer care and treatment is delivered more equitably for all who need it.
Director Grossi, many thanks to you too. And to close off now the summit's official opening, we have the pleasure to welcome the EU Commissioner for Health and Food Safety, Stella Kyriakides, who's going to speak to us now about Europe's plan for beating cancer. Commissioner, welcome, and over to you.
Thank you so much. Good afternoon, ladies and gentlemen. Let me first thank the Union for International Cancer Control for inviting me to address this very important World Cancer Leaders Summit. For better cancer prevention in the wake of this devastating pandemic, we really need to maximize the great potential of collaboration, of research and innovation. And today is a great opportunity to exchange ideas at the international level on the global challenge of cancer. Europe has less than 1/10 of the world's population, yet accounts for almost 1/4 of all cancer cases. While cancer, we know, costs Europe over 100 billion euros a year and puts an enormous strain on our health systems. Around 40% of cancer cases in the EU are preventable. However, only 3% of health budgets is spent on health promotion and disease prevention. And the COVID-19 pandemic, I believe, has further highlighted our tendency to underfinance and under-prioritize healthcare systems. We've seen, all of us, the impact of COVID on prevention, on treatment, and on care. And we need to address an important backlog that we need to catch up on. So cancer remains a huge challenge for all our societies, but it is also a scope for renewed action on cancer prevention, treatment, and care. It's never been more evident than today that we need to invest in our health, and this is why we launched Europe's Beating Cancer Plan in February, a key public health priority. It is also one of the founding pillars of a strong European health union. Its approach, this cancer plan's approach to cancer prevention and care, is inclusive, it's comprehensive, and it's innovative. It's inclusive because it involves the entire spectrum of cancer stakeholders and takes a health in all policies approach. It's comprehensive because it covers the entire disease pathway, from prevention and early detection through diagnosis and treatment to quality of life for all. And it's innovative because it both champions and leverages research and brings fresh approaches to tackling cancer. Through an innovative focus on prevention and key risk factors, we will address smoking, harmful alcohol consumption and obesity, and lack of physical activity through the promotion of healthy lifestyles. We'll be looking at environmental pollution and vaccination against HPV. It is about preventing the preventable, also for the benefit of other major non-communicable diseases, such as obesity, diabetes, and cardiovascular disease. In the area of early detection, we will step up existing programs for breast, cervical, and colorectal screening and develop a new EU cancer screening scheme. And through our actions to improve treatments, we will ensure better integrated and comprehensive cancer care and address the current unequal access to innovative medicines and therapies. To improve quality of life, we will be looking in our plan at issues affecting patients, their families, and carers. They include psychosocial needs, obstacles to returning to work, access to financial services, and other forms of discrimination, including the right to be forgotten. Working in tandem with the new mission on cancer, the Cancer Plan will deliver results in research, innovation, and digitalization for broader use. We will use all the benefits of this area, plus data and new technologies in a European health data space that will help us deliver up-to-date and comparable data, and our brand new Knowledge Center on Cancer, which will coordinate and align technical and scientific cancer-related work at the EU level. We're working on a new partnership and roadmap to personalized medicine to identify priorities for daily medical practice, and the Cancer Diagnostic and Treatment Initiative for All will make innovative cancer diagnosis and treatments more widely available. We are moving and working on a new upcoming European Cancer Imaging Initiative to bring an EU atlas of anonymized cancer-related images to a wide range of stakeholders. So thanks to all of these initiatives, and I know I've just listed many of them, but we will slowly become more aware of them being implemented, the EU's member states will be able to implement innovative policies, best practices, and promising new technologies to make their healthcare and social protection systems stronger. And this will make the EU closer to truly patient-centered healthcare models. Most importantly, it will improve the outcomes and quality of life for Europe's cancer patients and their families. Dear friends, research and innovation really permeate Europe's Beating Cancer Plan, and this is also true of our actions to tackle inequalities. We are building a new cancer inequalities register to help identify national and regional challenges and specific action to guide investment and interventions. And our aim here is to close the gaps between and within member states and between population groups. So as I said earlier, everyone has a stake in making the plan a success. We're working very closely as a commission and with national health ministries. There is an unprecedented funding of 4 billion euros for our actions, which will come from the EU4Health program. We're working with all research ministries, all stakeholders. And the first call for EU4Health project funding has now closed and the second one already launched. And we are soon publishing a roadmap for the cancer plan, which will give you key milestones and the timeline. So we must get to work. There are many actions of the plan. They lead to tangible benefits. It's clear to us that research and innovation will be key to our success, but so will coordination and effective partnerships. So let's all work together. Let's work together. And I thank you for the important work and collaboration that you all bring to the table. And together, I believe that we can make a difference. Addressing cancer concerns us all and can benefit us all too. Thank you.
Commissioner, thank you so much for joining us. And as you said, it was quite a long list of initiatives that you read out there. I'm wondering just if you can spare a few more moments with us, how difficult it's been to come up with initiatives and policy that covers all the member states when obviously there are different vulnerabilities in the different areas as well.
Yes, well, we've been working very, very hard with all the stakeholders in the member states, with the ministries in the member states. The cancer plan is a plan that covers the whole range. I just wanted to share with you that in building this plan together, we worked in it with over another 12, 13 commissioners. So it looks at the whole area of the cancer journey, from prevention to treatment to quality of life, but it looks at other areas as well. For example, as I mentioned, access to financial services, issues to do with discrimination and many other areas. So this is about putting down forward these initiatives, but then as I said, we're building an inequalities register, which the whole scope of that is to understand the differences between member states and within member states, only in order to help and support and implement. So we are working very closely with all the member states in order to be able to move forward with this plan. And I think it is an opportunity. We have a plan that is holistic, a plan that covers the whole range of actions, and the support of the member states and the European Parliament for this.
Commissioner Stella Kyriakides, we're so delighted that you've been able to join us for this virtual summit. Thank you so much for sparing the time.
Thank you so much. Thank you.
I hope you can maybe join us and tune in for the rest of the summit as well. But thank you very much for your time, Commissioner.
I will try. Thank you.
Thanks. Now, before we break for around 10 minutes or so, I would just like to try and connect us at least with the 2021 World Cancer Leaders Summit hosts, the American Society for Clinical Pathology, who are currently in Boston, and they're delivering their annual meeting. The meeting, of course, was originally supposed to take place in conjunction with the summit, and it is still taking place, of course, albeit in a hybrid format. So we can see you on the screen. You've obviously managed to make it into a lift or something like that to join us. But welcome. Good morning, Boston.
Thank you.
Thank you, Hannah. Thank you so much for figuring out a way to connect virtually. We're very disappointed that we can't be with you here in Boston, obviously, because of the immigration issues, but we are here for our ASCP annual meeting as well. I'm Blair Holliday, the CEO of ASCP. Next to me is Suzanne Zemnick.
Hello. Good morning, everyone. I'm the Chief Officer for Learning and Educational Research at ASCP and responsible for this annual meeting in Boston, and been thrilled to work with your team at UICC on the World Cancer Leaders Summit.
And we have Dan Milner.
Good morning, everybody. I'm Dan Milner from ASCP.
And so we're looking forward to obviously connecting with you virtually over the next couple of days. You're going to hear some incredibly inspiring speeches, especially from Dr. Atul Gawande, about innovation and cancer control. And he's also going to be a keynote here at our annual meeting as well here in Boston. But anyway, enjoy yourself. Hopefully you'll manage to connect with him live over the next course of the summit as well. But we are really looking forward to this summit, and thank you for all of the great work. I'm looking forward to hopefully connecting live with you very, very soon. Have a great meeting.
It's so great to see you guys, to Blair, Dan and Suzanne as well. And interesting you mentioned Atul Gawande. We are indeed going to be hearing from him very shortly, so excited about that. There's obviously a lot of crossover with our two events, with your annual meeting and the summit taking place virtually here from Geneva, but all with the same goals in mind as well. And it's wonderful to connect with you this morning. Have a wonderful day, and we'll chat later, I hope.
Thank you. Enjoy.
Thank you.
Have a great day.
Thanks, everyone. And as I said, we're going to be connected back to Boston tomorrow with the board of directors there. We are now going to have a 10-minute break, and we invite you in that 10 minutes to try to connect with each other on the summit platform. I'd also encourage you to join the summit conversation on social media. And we will see you back at 9 a.m. Boston time, which is 3 o'clock in the afternoon here in Geneva. See you in a bit.